This is Duke University.
Thank you for watching Tell Me More About Healthcare and Social Impact, where the CEO of GoodRx, Doug Hirsch, joined the Duke Career Center for conversations surrounding the mission of GoodRx and how it makes a difference across industries and in society. Let's join the conversation as Doug tells us a little bit more about his journey.
I was then the head of product at Facebook, back when Facebook was not evil. And then I moved into healthcare. This is my second company in healthcare. GoodRx has been around since about 2010. We help almost 20 million Americans every month find the care that they need to afford and often can't in this wonderful American healthcare system. We've saved Americans over $35 billion, and I can tell you much more about that as we get going. I have very little filter, as you probably can tell, so I'm happy to talk about anything you want today. So yeah, let's do it.
Okay, I may take advantage of that little filter that you have. And if you could tell me a little bit more of a deep dive then into that path, I think we may have questions surrounding, how do you get from that college setting all the way to where you are today?
Sure. I went to Tufts. Everyone can groan about Tufts. Actually, prior to even Tufts, when I was in high school and middle school, I promised my parents early on that I did not want to be one of those people. I grew up in suburban New York, and I did not want to be one of those people that wore a suit and commuted into Manhattan every day. And the idea of being a business person was just terrifying to me. And so early on, I decided I was going to do things that I love to do and really hope for the best. I think that following my passion has been really a driving force for me since day one. Like if it's something I'm not excited about, even if it's like a great business opportunity, but if I'm not excited about it and I'm not thinking about it, perpetually, then I don't really find myself sticking with it long term. And I think that's really important for people to think about. Is this something that you're truly passionate about? You're deep down very, very excited about this. And this can be anything. This can be, I want to make a ton of money. And so I'm going to do something that, you have to figure out what your values are and then match that with the things that you want to accomplish. For me, I think I'm wildly insecure. And so I want to be doing things where I can impact people's lives, whether that be in music, like I mentioned, whether that be using the internet, which, at the time and even today is built around connecting with people and changing the way people do everything, really. And now in healthcare, which I think is the most important thing of all, where, to be able to literally help, save people's lives, to be able to give people options so that they can find the care they need is incredibly fulfilling. And so for me, it really is around being honest with myself, knowing, by the way, that I'm not asking questions for the rest of my life. I'm asking questions for right now. And what are the things that are important to me in my life? Because that will change as you get older. I've got, as you already talked about, I've got 2 kids, and that changes your perspective too. But especially as someone who's young, who has very little to lose, you got to go with those passions, right? You got to go with what you're really excited about and what you lie in bed thinking about. And so that's been kind of a driving force for me. I don't know if I answered your question, but that's
You did. You did. So even thinking further into that, you kind of said something along the lines of being able to put stuff down if it's not for you. Was there something pivotal in your life and your journey that helped you get to that conclusion or kind of take on that mantra of, I'm going to put this down, that's not for me, I'm going to move on to the next thing? Was there something pivotal that kind of helped shape your vision of the next step?
I think, first of all, it's never one, like, I'd love to say that, at least for me, that my career has been a series of clear visions. I actually think it's been the opposite. I think every day is filled with self-doubt. It's the nature of the beast, but eventually you have to make choices and you need to move forward and say, this is what's going to work for me right now. Again, I can remember being paralyzed early in my 20s with, where there'd be questions like, I'd think to myself, oh my God, do I want to be doing blah for the rest of my life? And again, you really can't think that way. Sometimes I think in what was it, countries and other places thinking like 5-year plans. That's one way to look at it. I might not even go for 5 years, but I might think about, like, what is the thing that really floats my boat right now? You'll learn something. And oftentimes those best laid plans you have anyway go sideways. It's the people you meet. It's the things you didn't anticipate. I mean, again, I was working in the music business when the internet was effectively invented. And then literally, totally pivoted and went left, having no plans or intention of doing that. And so, I think you don't know unless you try. So obviously you need to get out there and go for things and try them. The other thing I think, especially as a young person, that people often fail to appreciate is, like, the demand right now, like, these people back here, they're in the driver's seat. These, this is the wave of the great resignation. And as some of you are entering the workforce, don't underestimate the value you bring to the workforce. Don't underestimate the value you bring to these companies. And it doesn't mean you should be obnoxious and cocky about it necessarily, but you're valuable and people want you and they want you to help drive the next wave of innovation for them. And so it's funny, I meet lots of folks who are, always insecure what's going to happen. And honestly, like, I would kill to be in your position and to be able to realize those visions and not necessarily have some of the overhead that I have at my age. I just, it's incredibly exciting. And I think as long as you can keep a positive attitude toward it, you can really accomplish anything.
Yes, definitely. I feel motivated right now. But
let's start a company right now.
Yeah, let's go. I was going to pick up and said, how do you feel about LimeWire and Napster if you started right in that boom? And I'm sure all of that was taking place, but we'll not digress into that.
Sorry about that, actually, but anyway.
So thinking through too, the time period we're in and looking at the economy, looking at a pandemic, looking at all these things that are larger scale obstacles, and even also students will enter into the workforce and they'll face other types of obstacles. Is there any obstacles in your own career journey that you can think of in particular that might be a good example? And then how did you kind of work to overcome that obstacles? How would you encourage students to do those things moving once they enter the workforce? Yeah.
I think life is a constant series of obstacles, right? And so I think, the question is knowing when to take action, right? Like, look, we all have bad days at work. I don't care if you've got the world's best job, you still have bad days. You're not always going to be doing things you love doing. And there's this weird middle ground between, overly entitlement where you think, well, every day has to be perfect. And I feel like a lot of times starting at my age and probably going down, you got to follow your dream and happiness and rainbows and unicorns and stuff. And that's all great. But, if you really have a vision, you have to stick through both the good and the bad days, right? And you see, I actually, full disclosure, I had like a nervous breakdown at age 25. I call it my quarter life crisis. And the net result of that was and it was mostly driven from the fact of like, oh my God, am I going to be behind a desk for the rest of my life? And I went to a career counselor, and the exercise then, and this is 1995, so it was long, I don't know if they've changed the way they do these things, was, it started out with a conversation of what's important to you, right? What are and at the time the exercise was like, if you walked up to a magazine stand, I know they don't have those anymore. Now I guess we just use the internet, but like, what would you be reading? What magazines would you grab off the shelf? Right. And I suppose today it'd be like, what websites do you go visit? Right. Or what apps do you have installed on your phone? And those can be anything, because everything is a business. TikTok is a business, obviously, gardening, I don't care what it is. These are all businesses. Someone has, created a business. People are making a lot of money if that's what's important to you. People are finding passion in all of these categories. And so it started with just what are the values that are important to you, right? Like, what do you care about, both subject-wise and value-wise? Do you value being in a social environment? I feel like I'm always bringing it up, I don't mean it, but, how important is compensation relative to, personal fulfillment and or both? Do you want to be in an outdoor environment? Do you want to be in an office? Do you want to, have a socially fulfilling thing? Do you want to work directly with people? Like you start with these check boxes, then you overlay it against actual career opportunities. You may do this, by the way, at the Career Center. So maybe I'm just saying what you do every day. But that was really helpful for me. I didn't come out of that process going, oh my God, I want to be an astronaut. But I came out of that process with the confidence of, okay, these are the values I'm looking for in the opportunities that are in front of me. And it gave me a better opportunity to judge the value of opportunities. And then as I'm doing those opportunities, to remind myself why I'm doing this, when you have a bad day, but I am trying to fulfill these things. I am trying to achieve these goals. And so I guess it's really just another way of saying, be thoughtful about these job opportunities, understand yourself and what you're ultimately trying to achieve, and that helps you navigate through these waters to make sure you're doing the right thing. And there will come a time where it won't check those boxes, right? I mean, I was just talking to someone a few minutes ago who went to medical school and halfway through was like, this is just destroying me, and pivoted. Now, of course, they have this wonderful knowledge they gained through medical school, but they also realized this is not checking those boxes anymore. So again, there's no perfect answer, but being introspective and understanding what your value system is step one.
Yeah, thank you. Thank you for your transparency too. I think one thing we often talk about in the Career Center with students and with our fellow colleagues is transparency and what to expect from people they go and work for one day. And can they identify that early on? And so it's good to see someone who is willing to be open about their own issues that they faced, and then how they are addressing them today, and how they hope that other people will address them and have the same courage to do those things in their life. We also do some of the value sorts and different things like that as well. So it still exists. And so we haven't tried to reinvent that because we don't really need to. It works on many different levels. And so thank you for bringing that up too. Talking about values is something we hope that people are constantly evaluating.
And I think it's an honest conversation, right? Too. I mean, I don't mean to keep bringing up the money making thing, but I have to imagine in everyone's career journey that comes up, right? How important is it for me to be able to sustain, right? To be able to either become, take a job that actually will compensate me, well, relative to take a job that maybe gives me social fulfillment. Now, obviously, the dream is that they do both, right? But I think that's an honest conversation that one should have. Like, I know plenty of people that are motivated by they just want to be as rich as possible. That's fine if that motivates you. I caution you that doesn't necessarily lead to happiness, but that is an opportunity that, or at least a value that someone should decide on, or just decide how important that is to them. Obviously. Anyway, I don't know. I felt like when I was coming out of college, that was something that was very important. A lot of people are like, I've got student loans, I got to pay these off. So the financial equation is going to be a big, that you may see that in the Career Center. For me, again, I was ultimately just motivated by, I couldn't do something that if I was paid a ton of money, but I didn't like doing it, I was never going to be able to do it. So anyway.
Yeah. There's a quote from Howard Thurman that discusses seeing people come alive. We need more people that have come alive in their work. And that really resonates with what you're discussing. And I think it resonates and carries through the mission of GoodRx. And that kind of brings me to my next question about that mission of GoodRx. We're in the middle of a global pandemic. It's still going on. And we're taking, I think the word pivot has been used often throughout this time, resonating with friends, and maybe too much if you're not a Friends fan. But also, if we look at the mission of GoodRx and we look at what we've been going through in healthcare, and we see healthcare employees, we see people across all industries really finding what is right for them. How has the work you have been doing and the mission of GoodRx, how has it been affirmed or impacted by what's currently going on?
I mean, it's I would say it's done nothing but really strengthen my desire to do what I do, because I think the people that work here, we have about 1,000 employees here, and everyone here is it's a whole different kind of problem. I mean, traditionally, GoodRx for the last decade is focused on affordability and convenience for people. We're going to make sure you can get the medications you need, make sure you can get the care you need. And then all of a sudden comes this pandemic, which is not really rotating around those issues. It's really more rotating around knowledge and information, and then ultimately access to vaccines, access to therapeutics, et cetera. And so, it's funny, an anecdotal story that I think summarizes this for me. My son came to me, this was about, I guess a year ago, right when the vaccines were basically about to be approved, but obviously they weren't going to be enough for everybody. And he wanted a new PlayStation for the holidays. And he says that to me, and I'm like, great. So I go online and look for a PlayStation. And if anyone here is a gamer, that there's not enough PlayStations at all for the number of people that want them. And so a light bulb went off in my head and said, wait a second, this same thing is about to happen with vaccines. And so in the course of basically a night, I basically sketched out a vaccine finder. This is prior to the vaccines being available, prior to people being able to get access to them, where we basically got access via a government database of every single pharmacy in the country and their existing availability of the Pfizer and the Moderna vaccine, so that someone who was really motivated or had compromise or whatever the issue is could literally go on our website, find where it was, and get down there and get the vaccine that they needed. And again, it was one of those spontaneous, we're just going to go for it. We spent some sleepless nights and we got it out there. We ultimately, I think about 5 million people used the product. And it's just, it was a great reminder of what we do, why we do what we do. And there's so many pain points in healthcare. And if anyone here is thinking about getting into healthcare, there's so much room. I feel like a lot of industries, you're like, too many people do it. It's saturated. Healthcare is a $4 trillion industry. Everyone needs healthcare, obviously, and this country is particularly broken and particularly going the wrong direction. And so there's no shortage of pain points to solve. And, the pandemic brought about 9,000 new pain points that we didn't know existed before.
Yeah. And thank you for the stats there. Thank you for showing how everyday life is impacted and by not only the pandemic, but also by your mission, and how that also impacts your mission as well. So I think your own personal story and how that's informing the work you're doing. And there was a few things that popped up there. There's a couple of words: adaptability, evolving, those types of words. And I think maybe that might tie in to perhaps the type of employee you may be looking for. So when it comes to the people that are working within your company, as someone who is managing people or working with people as a leader, what does it take to be a part of this team, and what kind of characteristics does this ideal candidate hold? And could you even discuss some potential opportunities perhaps Duke students might find with your company?
Sure. Well, we have a very active recruiting organization here. We've been trying to work with Duke Career Center. Our head of recruiting was actually on maternity leave, but she's back now, and we've been talking to Greg Victory, and we do want to get that pipeline going. I've had numerous Duke students here as interns, by the way, and it's great. So yes, is the short answer. We're really interested. Obviously, our career openings are listed on our website. If not, I'm happy to communicate with anybody. You're also just welcome to email me myself. My email is doug@goodrx.com, and I do read it, so just send it my way. So, I think the thing we most look for, and this has been a success for us for a decade now, is I know this sounds cheesy, but it's actually true, is we look for passion. We look for people who want to fix, healthcare, because look, people assume that you have to have some healthcare knowledge. People assume that you have to have an MPH or somehow understand the dynamics of healthcare in this country. But I don't necessarily want those people, because that system is broken. Right. And it's not that those are bad. We're happy to have people with that, but I care more about people who ultimately deep down want to fix the system here and who understand consumers, because what we're trying to do here is break the existing system, because it has so many flaws, and take the same knowledge that people have in other industries and apply it to healthcare, right? Like, why is it that it's so easy for me to book a plane ticket, but so hard for me to find the price for a doctor visit, right? And so I care more about people who understand humans, understand human behavior, understand user experience, understand, marketing, because we want to bring all the, healthcare is the last and biggest industry in this country that really hasn't evolved and hasn't taken advantage of technologies. And there's so many categories. We can break it down: medical devices, we can talk about insurance, we can talk about prescriptions, we can talk about medical care, virtual care. I could go on and on with all these categories, each of which is a bazillion-dollar category, and all of which are entirely broken and often move counter to the way other industries work. And so that's a long way of saying I value common sense so much. I value passion to fix this problem so much. And I value, someone who just understands people and understands behavior can get a really long way here. Again, we don't need healthcare lifers. We really don't hire a ton of them.
Yeah, and it makes sense too. I think looking at that model and thinking through that model, what would you tell a student to do? What's the next step for them? How would they? They can go on the website and they can log in, but how would you suggest them approach this?
I think, just email me. I know, I don't mean to sound dramatic. We're not a faceless organization. I hope I've impressed upon you already how informal I am, at least. And I never wanted to work at a big, scary company with 9 layers of people and, people not telling me the truth about what's going on. We're all in this together trying to fix healthcare. I am very passionate about working with really smart people. And as I already mentioned, don't underestimate the power of youth and the knowledge that you can bring and the pain points that you may have observed. For example, I've been doing a lot of work recently on women's health issues, and specifically women's health issues when you're in college, like 20s, because there's a lot of broken stuff there. I've been looking at a whole bunch of really cool companies that are trying to fix these pain points that I wasn't aware of. I think a lot of times people, they come out of, whether in college or graduate school, and they're like, I don't know anything. People in the workforce know everything. And it's just, there's not as much inbred knowledge as you think. And again, I just want to remind you how much knowledge you already have just by being a consumer, just by being someone who uses the healthcare system or someone who uses electronics or whatever that category is that you're interested in. And so in terms of getting to me, I already gave you my email address. It's doug@goodrx.com. LinkedIn, you can connect to me. That's fine too. I strongly encourage you to look at our available openings. And then if there's one particular you like, I'll just send it right to the head of recruiting. If it's not GoodRx you want to go to, I'm happy to connect you to other companies. If you're more excited about medical devices or, biotech or whatever the categories are, I encourage you to go right to the top. I mean, we live in a modern society where you'd be surprised how often people will reach out. Now, some people might not, but that's the whole point. You gotta step up to the plate and swing a few times before you get a hit, right? But you also have this amazing career center apparently that can also help you hit those connections as well.
No, I really appreciate that. I think it means a lot coming from you to say, just go take a shot, go for it. We're a basketball school. You got to shoot the shot. You have to. And I think it's important that they hear it from someone from your position and who has struck out a few times, but has gotten to where they are today because they took those shots and they put things behind them. And now you are in a position to be able to do what you do and make an impact and identify those pain points. I think pain points as well is an interesting phrasing that we don't think of when we think of corporate minds. We don't think of the word pain points and identifying issues in the world. So can you talk a little bit more, expand upon those pain points and how are you utilizing those to address certain issues with your company?
Yeah, I mean, let's see. Our company's evolution, it started with me walking into a pharmacy here in Santa Monica, California, and being told it would be $500 with a prescription in hand. And because I'm also somewhat cheap, I took it back and I went to the next chain pharmacy down the street and they said $250. I took it to a third pharmacist who chased me in the parking lot saying it'd be $400. I had no business model behind this. I just had an observation that something was messed up. Something's going on here. Because if I found this out, no one else around me knew that this was a problem. Everyone thought they had insurance, life was good. And it's those pain points. So that was pain point one. First of all, can we get our hands on this information? Can we figure out what a drug will cost so the patient can make smart decisions like they do everywhere else? And that's been most of GoodRx's timeline has been focused around getting those prices for prescriptions, both brand and generic. Brand was kind of our second one because they operate differently from generic. Today, we get 230 billion price points a day into our database. I mean, these are huge numbers and they make a real difference, right? As I said, Americans have saved $35 billion. I think almost half of US physicians basically distribute GoodRx materials to their patients. But that's only half the party. The other side was convenience, right? Meaning I can show you that a price is really cheap, but if you can't get that drug or you can't get to a doctor to get a prescription, which was a big problem in the pandemic, by the way. We also acquired going back to pain points, we acquired a telemedicine company during that time because people literally couldn't get to the doctor. So then we started focusing on convenience, and that can come in the form of a mail order pharmacy, that can come in the form of more knowledge and information, that can come in the form of, again, helping you just navigate and finding care around you. And so, those are some of the things we're knocking on. I'm trying to go way further than that because I'm not kidding when I say I want to fix healthcare. Like, that's not me exaggerating. That's actually what my job mission, my job is. And so I look at all the other pain points. And again, these are things that if I was in your position as people that are entering the workforce in some capacity, let's remember the facts here, right? The US ranks number 11 among OECD countries in terms of healthcare outcomes, and yet we spend 4 times as much money on it. Right there is like, if your alarm bells aren't going off in your head about I can do better, that should be, that's it. That's the area to be in. Again, it's a $4 trillion marketplace. And I'm not saying that so you can get rich. I'm saying so that you can fix that, because here's one of my favorite stats I'd love to give people. 1% of the US gross domestic product is spent on dialysis in this country. 1%. So we all scream about military spending. We all scream about, whatever thing you don't care about, or, you think we shouldn't be spending money on. You're spending a cent of every dollar in this country is going simply toward dialysis, much of which is preventable if only we help people find access to low cost medications so they didn't get diabetes in the first place. And yet who's doing it in this country? No one's fixing that. So will one of you please go fix that so that my tax dollars go somewhere better and we don't have the ginormo $1 trillion debt that we have? That's one of 9,600 problems I could point out to you. So please go into healthcare and please fix this.
I appreciate it. I'm going to give you a chance for a stump speech here in a minute. But before we get to that, I want to talk about vision, and I want to talk about where you see the next 5 years going, whether it be with GoodRx or even beyond. And what would you like the people in attendance today to know about the vision of GoodRx and also what you have going ahead of you now?
Sure. And I also want to point out that when I started GoodRx, I didn't have a lot. I wasn't really a healthcare. I worked in technology, right? So this is not, I feel like a lot of folks are like, that's great, Doug, really appreciate the speech, but yeah, you've got all the advantages and all this other stuff. But, if you know, I don't know, some computer science person at Duke who can help you build an app, or you can do a little bit of research, or you can make 2 phone calls, like I could walk you through the GoodRx building story, but most of it was just literally legwork and asking. And by the way, when you ask, a third to 3/4 of those people will tell you you're stupid and that was a bad idea. That's fodder for like going for it even harder, right? Like, so it is, don't underestimate the tool set that you have, and don't think that wall is higher than it really is for you to get into that. In terms of the future of GoodRx, I mean, the future of GoodRx is hopefully the future of U.S. healthcare, right? Which again is it's just getting worse here. It's somewhat of an embarrassment. Everyone, I feel like in this country, we love to walk around going, America number one, and we are definitely not number one in healthcare. We have some great innovation. For example, as you know, the vaccines, some of them were made here. We do have a very robust, for better or worse, drug development process here. But of course, we also pay way more than any other developed nation for those drugs, right? I dream of a day where, I don't know if anyone on this call is from another nation, but when in other countries, in many other, at least developed countries in the world, you don't go to sleep at night worrying about being able to afford care. You may worry about access to care, meaning like, I have some friends who are Canadian, for example, and it can take a while to actually have that surgery done or things like that, but you're going to get it. But in America, we actually don't have that safety. There isn't that sort of baseline underneath it. And we're unique in being this incredibly wealthy country that people still, like, I have too many friends who just avoid care. They're just like, I'm not going to go. If I go to the doctor, it's going to cost me $1,000. And I think I can blow that up. I think that we can come up with ways to give people knowledge and give people the tools so that they can navigate our messed up health system, or better yet, build a new one. I got a phone call a few months ago from a very senior person at one of the biggest pharma companies in the world. And literally out of the blue, he found me on LinkedIn and he said, hey, I'm so tired of the way the system works. It's driving me nuts. Too much money is going in all these random places. I just want to make a drug and I want to sell it to someone for a fair price, and let's get rid of all the garbage in the middle. And I was like, great, let's do it. So now we're working on it, right? Like, so it's just, I think we're getting to that pain point in this country where it's so messed up and we're running out of money with Medicare, blah, 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 that eventually change is going to have to come. And I would like to be a part of the force for good there. I don't say this, by the way, as the CEO of a public company and wants to see my stock go up. I say this as a U.S. citizen, as someone who just wants to improve the state of what's happening in this country. And, I love this. I go to sleep thinking about it. I wake up in the morning thinking about it because I feel like clearly our government has not been able to solve this one. It just gets worse and worse. Private industry has all sorts of motivations that seem to be broken. Maybe we can do it. Maybe we can help educate, empower consumers to have a consumer-driven healthcare, model in this country. So, yeah, that's the things I think about.
And there's the filter thing again too. Thinking about the government and their action, and also the other broken parts of healthcare as a whole. And so, once again, I appreciate you in your position being able to say those things and say them to people before they go into the industry. And so this is your stump speech chance now. What is the thing that maybe we haven't asked and you would like to say to these students, future possibly employees, about GoodRx, about the mission, about what you hope to do?
Sure. I mean, I think I've given you guys a lot of some perspective on the things that we're trying to tackle here and the categories we're looking at. I think we are looking for people of all shapes and sizes here, everything from like healthcare economists to writers to people with MPHs to we have MDs, we have RNs on staff, we have behavior folks. I was just meeting with a UX researcher a few minutes ago. We have product people. We have 400 developers, I think. You name it, if you're coming out of Duke with it, it's of interest to us. And even if you don't have one of those things, again, there's plenty of ways for you to come work with us. And so, yeah, I think there's lots of options for folks to work with us. Again, I also at the same point want to encourage you at this young age to think about, again, as I talked about before, like looking around at the other folks around you and the skill sets that they have, and the weapons at your disposal, whether that be, all the knowledge and experience that you bring to the table. Because it's also a great time to be an entrepreneur, especially in times of disruption now between the pandemic and the war and the broken state of healthcare. And again, I'm not even limiting it to healthcare, but it's raising money is always an option for someone to try something out. Companies like mine are very attracted to people who took a swing at something and, learn, even if it didn't succeed, who cares? You learn, oh, wow, this is how one markets. This is how someone does social media. This is how someone, and that knowledge that you gain out of trying something yourself is invaluable as well. So, I guess the one word I think about for all of you guys is opportunity, right? Incredible opportunity if you want to come work here. I'll be honest, we are paying extraordinary salaries these days. It is incredibly competitive. People are resigning from current jobs and getting the perfect job in the perfect location that they want. Take advantage of that, or go start something new because the world's hungry for it. So, yeah.
That was perfect. Thank you. And with that, I want to open it up. I want to open it up to the people attending today. If they have any questions, feel free to type in the chat. Yeah, we'll go from there.
Hello, my name is Vanessa. I'm a master's in global health student at Duke. You talked about some of the pain points in healthcare, specifically, within the US. When I put a global lens on some of these things, those pain points just get bigger and more complex.
They do.
How do you address kind of knowing even where to start? I know in global health too, we focus a lot on how interconnected some of these things are, that they can be structural. So how do you approach when you see kind of one of these problems, and how do you know whether it's one that you can actually solve?
Yeah, I mean, first of all, you can solve it. So to say, I wouldn't doubt yourself, assuming you have sufficient knowledge. My expertise is definitely in the US. I did recently take a Penn course on comparative health systems, and it was fascinating. What you see about all these health systems is they do exactly what the health system encourages them to do, whether it's on purpose or by accident. I remember reading about, like in China, for example, hospital prices are limited, but hospitals can sell drugs. So surprise, people take like 10 times the number of drugs in China as they do here, because that's where the money's made, right? And you have to, and then I think in England, it's more of a primary care-based system. And there's no perfect answer. I mean, what I learned from that course was, none of them are perfect. There is no perfect healthcare system, but how can you work to make them more perfect, right? And to take the comparative weaknesses that any specific system says, whether it be a modernized country or a country where they just don't have access, and make care affordable or advocate on their behalf. I mean, the nice thing about healthcare is there's no shortage of people. I mean, you don't get into healthcare generally. You get into healthcare because you want to help people. And so even in I would say the poorest countries, you've got a ton of, whether it be both dollars and available, people who want to get involved and want to help. And so, I think for me, what would be fun if I was in your position is to look around and look at the health systems of all the various nations you might be interested in, see what their weaknesses and gaps are, and then see if that aligns with your knowledge or frankly, where you have an idea on how you could do better. Right? Like, what would you do if you were in China, or what would you do if you were, in England and there was, primary care, and also take the learnings as well. I mean, I should go get a global health degree because I love learning about, it's like El Salvador or Guatemala, where every household gets a visit from a primary care doctor. What a great model that is. Anyway, but I mean, what we don't get, I feel like, is a lot of cross-pollination between the great ideas in one place and how that could be applied somewhere else. So in short, what a great entrepreneurial category. I don't have the answer. I bet you do. So go for it.
Thank you for that question, Vanessa. Does anybody else have anything else that they would like to share or ask?
Does anyone want to ask about our amazing office?
Hi, I had more of a general question. I am Athena. I am interested in the entrepreneurial side of things specifically, especially in like technology, in like med tech and that sort of thing. And I was just wondering if you saw any like trends or if there were any emerging technologies or really any changes in healthcare, like in terms of disruption that you were excited about.
Yeah, I mean, an area that I would like to reinvent the primary care physician to patient relationship, right? I mean, on a few levels. First and foremost, I want to align credentials with time, right? Like, for example, well, then the one I always love pointing out is birth control. Like birth control, anyone can basically prescribe birth control. There's obviously limited side effects. And yet the fact that a doctor, a practicing doctor who is $1 million in debt and charges probably an average of $400 to $500 an hour is involved in that process makes no sense, right? I think we all know that. It's kind of obvious. So I think about like, how do we align credentials so that you can find affordable care? Right? I think also mental health is wide open with this. You probably all know a psychiatrist like $800 an hour, but you can get similar output out of someone who's much lower credentials and still provide great talk therapy and things like that. And so one obsession is just around how do you mix and match so that a patient can find affordable solutions? But then going beyond that, let's talk about like a more proactive setup. I mean, you know about wearables, right? So you can see how many steps and my blood pressure, my pulse ox. And there's companies kind of poking at that, but no one's done a great job. But wouldn't the ultimate physician-patient relationship be one of, instead of me going to visit you once a year, it'd be a constant ongoing relationship where maybe there's some AI or something involved where basically the physician reaches out to me when they see something is up, right? Like, hey, Doug, I've noticed your blood pressure's been up for like 4 days straight. Or, hey, Doug, this seems strange. But they don't reach out and they're not even notified about it until, a system basically says, hey, it's time for us to interact. Because it just seems ridiculous that it's all sort of patient driven right now. And it's not, we have the tools available. We're pretty much there in terms of name the device, whether it be, internet connected scale, internet connected blood pressure cuffs, internet connected, pulse ox. Again, I mean, I could go on and on. Diabetes, we've got these glucose monitoring tools now. Like it's all there. We just need someone to put it together and then put it in a nice package so that, and by the way, who's paying for it is the key. And I mean, because that just seems like an area that's wide open. And that's just one example of an area. There's also, you should follow legislation because legislation's a great example. During the pandemic, as some of you may know, a lot of the existing sort of remuneration rules around, for example, virtual visits, so you could get paid, a physician could get paid for virtual visits. That may or may not go away. But you see, unfortunately, people follow the money, right? So there's some open questions about like a virtual visit experience, whether that will be paid for or not. I don't know, anyone who's been on Instagram lately, seeing all these direct to consumer subscription products like the Romans and the Hims and the ADHD services, what's going to happen with those? No one's figured out mail order pharmacy. I'll just point that out, lest you think they have. They haven't, including Amazon, Mark Cuban, us, anyone else. So anyway, the good news is, there's everything, unfortunately, is on the table. But I do think that specifically, as medical devices get smaller and cheaper, the question becomes, how do we make them a part of the fabric of the consumer healthcare experience?
Thank you.
Yeah, I appreciate that. We talk about reinventing the wheel, and then we think about the wheel's actually been reinvented over and over again. It's been made better. So any other questions? I see, Margaret, you've turned on your screen.
Yeah. Sorry if there's background noise. First off, this has just been really interesting, and I appreciate the realness and authenticity here. I am a graduating senior, really passionate about women's health, and you've mentioned a few different sort of up and coming women's health things and everything. I feel strongly about like going to med school to actually become a physician and like work in the room and deliver care to people who need it, especially in under-resourced areas. But I'm curious how you partner with physicians to also address these larger scale issues, because I also really care how the whole system of women's healthcare is super broken and a lot of the issues in it too. So like physicians' roles and the type of work that we do.
Yeah, I mean, it's tricky because a lot of this stuff does require, lobbying and change from institutions that don't necessarily want to do it. I'm not a huge fan of some of the rules that the AMA has put in place, so that, for example, nurse practitioners and nurses can't do a lot of things, which I find to be frustrating. However, I think Again, I'm mostly focused on the cost aspect, right? And making sure people have access. I mean, we have major access issues, as you can imagine, places like Texas and things like that, where there's like legislation that's preventing some women's health services being performed. In that case, we really focus on education and publishing information on the internet, giving people guidance, telling them clinics that they can go to. But the other thing that we try to do is, again, really focus on cost, show people that you can get access to these services, give you directories of clinics so that women can figure out where to go. There are some DTC services, again, that like there's a number of services that popped up recently where they're doing like a combined package for women, where it's like, I'm making up the number of $50 a month, and you get mental health services as well as basic women's health services in one package with a really cool app. We'll be curious to see how that all plays out, and that does require a cost. But we're seeing a lot of innovation there. Like one thing I did not know, I assumed the campus health centers were amazing. I haven't been in college since 1992, but I've heard that there's actually some gaps there. I don't know, you guys would know better. And so some of these companies are kind of looking at that and trying to fill in the gaps where, campus health centers are not available, or access to morning after pill, or again, just knowledge and education. So, and then of course, don't forget there's Planned Parenthood behind this. A lot of times I've dug into the space and realized actually Planned Parenthood's great. People just don't know about it. So you may even choose to want to work with them and help them get the word out more. I actually think it's a great organization, but when I looked around at comparing prices, I realized that Planned Parenthood actually has pretty competitive prices for a lot of stuff. So maybe, I don't know if that may not be true. You may know more about it than I do. So I don't have a great answer for you, except that I think a lot of it comes down to knowledge and awareness, and then affordability. And those are the things I think about. If you actually email me, there's a company, and I'm blanking on the name of it. I want to say it's Jade Health or something, that's going after exactly this. And they're a really young startup that would probably kill to have you help them out. And I can connect you to them if you're interested.
Thank you. Sounds great.
All right, just a few more moments. So if you've got one, if you got a question, go ahead and shoot your shot like we talked about.
So I would be remiss if I didn't ask the Career Center question. We are consistently getting questions from students regarding resumes, right? Each industry area seems to want to see a different formatting in resumes. And we always have, this is my resume, that it's not going to speak to the industry, or I'm concerned that I'm not going to have the right keywords on it, or I'm concerned that I'm interested in many different areas and everybody's looking for different resumes. So can you shine some light on, if you were to look at a resume for somebody that was potentially coming into your company, maybe the first and second thing you're looking at and paying attention to?
Yeah, and I want to caveat that I do not do the hiring here at this point, but I'm happy to connect you guys to the people that do, and they are connecting with your career center. So that is possible. But I mostly just looked at LinkedIn. I hate to say it. I find that to be a pretty valuable resource. I can also see if I have connections in common. So I think that's helpful. I think in terms of format of resumes, I mean, this was taught to me a long time ago, but I try to keep things to like one page, and I don't want, especially if someone's going through a large number of them. So I think, brevity is better. I think, I don't know. I find that for us, we don't study the resumes tremendously hard. We use it to get a general overview of the person, make sure they're, please don't misspell things and things like that. I've seen too many of those. But I think if you can just put something together that is simple and concise and interesting enough that we want to reach out and talk to you. Again, for me, I just use LinkedIn. Someone gives me a name, the first thing I do is I just search their name plus the word LinkedIn. And I feel like I get as much, if not more information. It's pretty well organized. But I don't know if that works for, again, I'm also happy to have our career center answer that question if you prefer.
Awesome, thank you. And kind of along the lines of that, I think one of the other questions that we have from our students are kind of in regards to interviewing and what that process looks like. I think sometimes students have the question where they're trying to figure out, are we going to have a common behavioral interview? Is there going to be some technical aspect that I may have to scenario base? How do interviews, or do you know a kind of what interviews look like for you?
Yeah, I think it varies. I mean, to state the obvious, we're developing when we're interviewing developers, we ask them more technical questions about, to assess skill level and things like that. Again, I think for lots of other categories, that passion needs to show through. So we are looking for people who care about healthcare. I'm not, if two people come in and one of them is, doesn't care about what we do for a living, again, I resonate a lot with personal stories and people understanding, hey, this happened to my family, and I want to make this right next time. In terms of interviewing best practices, yeah, I mean, I think I just like to get to know people and really, understand a little bit more about what they're really interested in, what they're passionate about, and then get examples of things that they've, done in the past or things they've thought about. This does not have to be professional examples. This can be, I don't know, I was at Duke and I was really motivated around this issue. And so I got 10,000 people together and we did this, don't underestimate the things that you do in college. Those are important. For me, I had a lot of tremendous success doing internships when I was in college. And I walked out of school with not only great relationships, but also things that looked like experience. So yeah, I don't know if that's super helpful, but those are things that we look for. Yeah.
Thank you.
I do want to ask about the office. Is that a big green field behind you or what?
That is actually a surface of moss. That is living moss that I didn't know about. I did design this office, but that one was a surprise to me. That's our barista station right behind my shoulder here. We also have a hidden speakeasy, which is underneath me here. I'm just trying to attract all you guys to come work here. And then it looks like we're having, I don't know if you can see it from here, but it looks like we're having some sort of all hands company drinking session. I don't know what that is over there as well. So, I mean, we really are trying to get people back in the office. That's another tricky issue post-COVID. That'll be really curious to see what your world looks like, because I talked to all my friends. We're trying to figure this out. We have 450 people that live in the Los Angeles area, and I'd say maybe there's 175 or so here today. We try to make the world's greatest working environment here. But even then, if someone moved to Denver, they're not coming in, right? So yeah, that's what we're all about. I'd love to give you all a tour someday. It's a pretty cool space.
All right. See, I have a counseling background, so I could sit in silence for hours. But I will not do that. Thank you, Doug, so much for being here. Thank you for your transparency. Once again, thank you for helping our students see the next steps and see how you got to where you are, but also having an open door. I think that's one of the biggest things too, is seeing an open door and helping people find their way to step through it is really part of the next journey. And really excited to hear about the things about GoodRx, as well as the other things you share beyond just that. I think that is super important as well. So without any other questions, Nicole, do you have anything else?
I don't. Just thank you as well. This session was recorded, so it'll live on the Career Center website. Give us a few days to do a little magic, and you guys can go back and reference this. If you missed an email address, if you missed an opportunity that you might be interested in, you'll have the opportunity to go back and check out the video and be able to hopefully connect with Doug. And I can't encourage you more. You have a CEO telling you, reach out to me. You hear us tell you this all the time. This is the ultimate networking piece that has just occurred. And you all got a very great, genuine, sincere heads up just now. So thank you, Doug. I appreciate that.
Thank you, guys. You may see me on campus this Saturday anyway, wandering around. So and if you see me, say hi. But otherwise, I really appreciate the time. I am cheering all you guys on. So yeah, let me know if I can help anymore. All right.
Awesome. Thanks so much. Everybody have a fantastic evening.
Thank you, guys.
Great.
Bye.
Thank you so much.
Bye.
Thank you.